Hello, my name is Mackenzie and I am the dental hygienist at Philadelphia Fite Family Dentistry. Today I will be discussing periodontal therapy. At the initial cleaning appointment, measurements or periodontal charting will be recorded from the space in between the patient's teeth and gums, known as the periodontal pocket, by using an instrument called a probe. In some cases, a cleaning called a debridement may be necessary to complete prior to periodontal charting if there is a heavy amount of bacteria buildup above the gums to the point where the periodontal pockets cannot be accessed. Periodontal charting and a full mouth of radiographs are necessary to establish the overall health of the patient's gum and bone. Healthy gums will typically result in smaller measurements, and unhealthy or infected gums will usually present in higher recordings or deeper pockets. Healthy and stable measurements normally consist of 1, 2, and 3 millimeter pocket depths. 4 millimeter pockets indicate the first stage of gum disease, as inflammation is present within the gums, and we refer to this as gingivitis. Gingivitis is also the only reversible stage of gum disease, as its signs and symptoms include swollen and red gums that may bleed easily when brushing and flossing. Gingivitis can be reversed by seeing a dental hygienist at least 2 times a year for professional dental cleanings and by performing proper home care. Home care should consist of brushing with a soft or extra soft toothbrush 2 times a day for 2 minutes each time with fluoride toothpaste, and by flossing and using mouthwash daily. Additional tools or products may be recommended to you by your dental professional depending on your individual needs. Periodontal measurements of 5 millimeters or higher signifies periodontitis, which is the next stage of periodontal disease that is irreversible, as there has now been loss of supporting tissues such as bone, gum, and periodontal ligaments, which are all essential structures to keep the teeth in place. When gingivitis does not get addressed early on, it will continue to progress, eventually leading to larger pocket depths where the bacteria can build up deeper within the pockets that then further destroy the supporting tissues surrounding the tooth. Signs and symptoms of periodontitis are similar to gingivitis, but also may include bad breath, loose or mobile teeth, and the possibility of pus in the infected pockets that can lead to swelling and a bad taste in the patient's mouth. Those with periodontitis need a more in-depth cleaning that is called scaling and root planing, which is also known as a deep cleaning. Scaling and root planing is a procedure that is performed to remove bacteria that has not been removed off the teeth properly by daily brushing and flossing, and has now gone from a soft and sticky consistency to a cement-like substance. Bacteria in your mouth will start to form immediately after being removed, and this is why brushing in the morning and at night is recommended. Dental plaque is a yellow sticky film that is constantly accumulating on the tooth surface and contains millions of different bacteria. It only takes about 48 hours for the plaque to harden and turn into tartar by mineralizing with the saliva in our mouths. Certain kinds of foods and beverages can accelerate the bacteria buildup, such as carbohydrates, simple sugars, and starches. Once tartar has formed on the tooth surface, only a hygienist or a dentist is able to remove the deposits with dental instruments. The instruments used during scaling and root planing consist of a cavitron or piezo. These are instruments that use water to help remove the heavier deposits of tartar off the teeth. Hand instruments are always used afterward to remove any additional deposits. Scaling and root planing procedures involve anesthesia to numb the area of the mouth being worked on, and usually requires 4 different appointments with focus on one quadrant at a time. In dentistry, quadrants consist of the upper right, upper left, and lower right. Anesthesia is used to be able to remove these deposits of tartar without causing the patient pain. Those who are more susceptible to developing periodontal disease at some point in their lives are those with heart disease, diabetes, pregnant women, those taking certain medications, or who use tobacco products. In some severe cases, patients may be referred to a periodontist for periodontal surgery if the pockets are too deep and additional instruments, equipment, and procedures are needed. Next, I will cover how you can prepare for a scaling and root planing appointment. One should always have something to eat and take their regular medications as recommended by their doctor prior to dental procedures, as anesthesia will be used for scaling and root planing appointments, and the patient may be numb for several hours after their appointment has been completed. It is suggested to be cautious after these appointments before eating and drinking until all the anesthetic has worn off, as it may be difficult to feel your tongue or cheek after the procedure. It is normal to notice more sensitivity to hot and cold foods, even up to a few days after your cleaning. This can be expected as the tartar was covering the teeth and acting as a barrier to temperature and has since been removed. This sensitivity should subside within a few days. If sensitivity does not subside, you should switch your toothpaste to a sensitive toothpaste like SENSODYNE and rinse with a fluoride mouthwash. To help promote healing within the gums, it is advised to do warm saltwater rinses 2 to 3 times a day for a few days after your procedure. If possible, do not smoke for 24 hours after your appointment, as smoking can increase your chances of getting an infection. After the anesthesia has worn off, if you're experiencing any discomfort, you can take over-the-counter pain relievers that you would usually take for a headache, such as ibuprofen or acetaminophen, unless told otherwise by your doctor. If you experience bleeding after your appointment, you should take a clean piece of gauze, get it wet, and squeeze out the excess water, then press it firmly on your gums for about 10 to 20 minutes. If you do not have clean gauze at home, you can use a black tea bag instead. If bleeding persists after repeating this step 3 times, please call your dental office and let the doctor know. After all the quadrants have been treated, you will need to return to the office in 6 weeks to evaluate the healing of the gums. If there has been improvement in the patient's home care and periodontal measurements, then they will have all their teeth cleaned that day, without any anesthesia. The best ways to treat periodontal disease after scaling and replaning appointments would be to visit your dental hygienist every 3 months for routine cleanings and perform proper daily home care. It is necessary to see a dental professional every 3 months after scaling and root planing to maintain the health of the gums and try to avoid the disease progression. Thank you for your time.